There are 5 foods sitting in refrigerators across the world right now that millions of people are reheating every single day. You have foods that seem completely safe, foods that have been eaten for generations, foods that nobody has ever warned you about. And when those specific foods are reheated incorrectly, they undergo chemical transformations that produce compounds linked in published research to increased oxidative stress, cellular DNA damage, and a heightened risk of pancreatic cancer. One of the cancers with the lowest 5-year survival rates of any malignancy we know of. Pancreatic cancer kills quietly. It develops in almost complete silence. It produces almost no early symptoms until it has reached a stage where treatment options are dramatically limited. And by then, for the majority of patients, the window for meaningful intervention has already closed. We cannot always control our genetics. We cannot always control every environmental exposure. But there are specific, identifiable, and completely avoidable dietary habits that research has linked to increased pancreatic cancer risk. And one of the most common of those habits involves something almost every household does every single day without a second thought. I'm Dr. Michael Kent, and today I am naming all 5 foods, explaining exactly what happens to them chemically when they are reheated, and telling you the simple, practical alternatives that protect you without changing how you live. This is information I believe everyone needs to hear, and I am sharing it today because the earlier you know, the more you can do. Let us get into it. Before I name the 5 foods, I want to make sure you understand why the pancreas specifically is so vulnerable to the types of chemical compounds we are going to discuss today. Because once you understand this, the connection between reheated food and pancreatic cancer risk will make complete scientific sense. The pancreas is a dual-function organ. It produces digestive enzymes that are released into the small intestine to help break down food, and it produces hormones including insulin and glucagon that regulate blood sugar. Because of its central role in both digestion and metabolic regulation, the pancreas is directly exposed to the chemical compounds present in the food you eat, and specifically to the metabolic byproducts that your digestive system produces as it processes those compounds. When foods are reheated, particularly at high temperatures in certain cooking methods or after having been stored and then reheated repeatedly, they undergo chemical changes that produce what researchers call advanced glycation end products, or AGEs, as well as other compounds including nitrosamines, acrylamide, oxidized lipids, and heterocyclic amines. Each of these compound classes has been studied in relation to various cancers, and the pancreas, precisely because of its intimate exposure to the digestive environment, is among the organs for which research has found the most consistent associations with dietary carcinogen exposure. I want to be clear, as I always am on this channel, diet is one factor among many in cancer risk, and no single food causes cancer in isolation. What I am presenting today is research-informed risk reduction, the kind of information that, when acted upon consistently over time, meaningfully improves your overall cancer risk profile. With that clearly stated, let us look at the 5 foods. If you are new to this channel and you want honest, doctor-led, evidence-informed health content every single week that you can actually use, go ahead and subscribe right now and hit the bell notification so you never miss a video. Everything on this channel is free, everything is grounded in real research, and every video is made with one purpose: your health. Now let us get into the first food. The first food is processed and cured meats: bacon, sausage, salami, hot dogs, deli meats, and similar products. These foods are already classified by the World Health Organization's International Agency for Research on Cancer as Group 1 carcinogens, meaning the evidence that they increase cancer risk, including colorectal and pancreatic cancer risk, is considered sufficient at the level of established scientific consensus. The reason they appear on today's list specifically is what happens when they are reheated. Processed meats contain sodium nitrite, a preservative added to prevent bacterial growth and maintain color, which, when the meat is exposed to high heat a second time, reacts with naturally occurring amines in the meat protein to form nitrosamines. Nitrosamines are among the most potent carcinogens identified in food science research. They are directly genotoxic, meaning they damage DNA, and they have been consistently associated in epidemiological studies with increased pancreatic cancer risk. A fresh processed meat already contains nitrosamines at a baseline level. A reheated processed meat, particularly one fried, microwaved at high heat, or grilled a second time, contains them at significantly elevated concentrations. The recommendation here is straightforward. If you consume processed meats at all, do not reheat them. If you are making a hot meal, cook fresh and consume immediately. Do not store cooked bacon or sausage and reheat it the following morning. The risk from the reheating step is real and it is avoidable. The second food is starchy foods cooked at high temperature, and this category includes potatoes in particular, as well as bread, pastry, crackers, and other starchy items that have been baked, fried, or roasted. When starchy foods containing the amino acid asparagine are exposed to high heat, above approximately 120 degrees Celsius, a chemical reaction occurs between the asparagine and naturally present sugars that produces a compound called acrylamide. Acrylamide is classified by the International Agency for Research on Cancer as a Group 2A probable human carcinogen, meaning animal studies have demonstrated clear carcinogenic effects, and the available human epidemiological data, while still accumulating, suggests a probable association. Research has specifically linked dietary acrylamide exposure to increased risk of pancreatic cancer in several large cohort studies. Now, here is what makes reheating particularly problematic for this food category. When starchy foods that have already been cooked at high temperature, already containing acrylamide from the first cooking, are reheated, particularly in an oven, air fryer, or at high microwave power, the acrylamide formation process can continue and deepen, increasing the total acrylamide load in the food beyond what was present after the initial cooking. Roasted potatoes reheated in an oven, chips reheated in an air fryer, reheated pastry or toast. All of these represent a compounding of the acrylamide exposure that the first cooking already initiated. The practical advice here is not to eliminate these foods, but to change the reheating method. Starchy foods are far better reheated gently, at lower temperatures for shorter periods, than return to the high heat environment that drives continued acrylamide formation. Steaming reheated potatoes rather than re-roasting them is a meaningful risk reduction step. The third food is cooking oils, and specifically oils that have been used for frying or high heat cooking and then stored and reheated. This is an extremely common practice in many households. A pan of oil is used for cooking, cooled and stored, and then reheated the following day for the next meal. When cooking oils, particularly polyunsaturated vegetable oils, including sunflower oil, corn oil, and soybean oil, are heated to high temperatures, they undergo a process called oxidation, producing a family of compounds called aldehydes. The primary aldehyde of concern in this context is 4-hydroxynonenal, or 4-HNE, along with malondialdehyde and other reactive aldehydes that are generated in increasing concentrations with each subsequent heating cycle. These aldehyde compounds are highly reactive. They bind to proteins and DNA within cells, causing the kind of oxidative damage that is a recognized driver of carcinogenesis. Research has linked elevated dietary aldehyde exposure, primarily from repeatedly heated cooking oils, to increased risk of several gastrointestinal cancers, including pancreatic cancer. The pancreas, as a digestive organ directly exposed to the products of lipid digestion, is particularly vulnerable to the effects of oxidized lipid compounds. The recommendation here is clear and practically simple. Never reheat used cooking oil. Use fresh oil for each cooking session. When you have finished cooking with oil, discard it rather than storing it for reuse. This is a habit change that costs almost nothing and that removes a genuinely significant source of dietary oxidative damage from your regular exposure. I want to stop here and share the story of one of my patients. His name is Ralph, and he shared his experience with me and gave me his full permission to tell it here because he felt strongly that what he went through might help someone watching this video make a different choice before it is too late. Ralph came to see me not as a new patient, but as a long-established patient whom I had been seeing for general health reviews every year for almost a decade. He was 67 years old, a retired electrician, a practical and straightforward man who had always been broadly healthy. No significant diagnoses, no medications, a non-smoker, a moderate social drinker, and someone who walked regularly and took reasonable care of himself. At his annual review approximately 2 years ago, he mentioned almost in passing that he had been having some persistent indigestion and a vague discomfort in his upper abdomen that he had attributed to a change in his diet during a long period of home renovation when his kitchen had been out of use and he had been eating mostly reheated takeaways and convenience foods for several weeks. I ordered an abdominal ultrasound as a precautionary measure. What the ultrasound identified and what subsequent CT imaging and biopsy confirmed was an early-stage pancreatic adenocarcinoma. Early stage, caught before symptoms had become unmistakable. Caught because a routine review led to a routine investigation that led to a finding that in most people goes undetected until it is far more advanced. Ralph underwent surgery, a Whipple procedure, followed by chemotherapy, and I am very glad to tell you that at his most recent review, he is doing well, and his oncology team are cautiously optimistic about his ongoing surveillance results. But the conversation that stays with me from those early weeks after his diagnosis was one in which Ralph went back through his dietary history with a kind of methodical attention that I think came from his decades as an electrician, someone trained to trace a fault back to its source. He had for years been a heavy consumer of processed meats, sausages, bacon, and cured meats that he often cooked in bulk and reheated through the week. He had always reheated his cooking oil, a habit he had maintained since his working years when economy in the kitchen was a necessity that had simply become routine. And he had, like many people, never once considered that these ordinary, unremarkable habits carried any risk at all because nobody had ever told him. He was not asking me whether his diet had caused his cancer. Causation in oncology is almost never that simple or that certain. What he said was something slightly different, and something that I think about often. He said, if someone had sat me down 20 years ago and told me that these specific habits had a credible connection to pancreatic cancer risk, I would have changed them the same day. They were not things I needed, they were just things I had never thought to question. That is why I make videos like this one, not to create fear, but to create the opportunity for the informed choice that Ralph was never given. Let me now continue with the fourth and fifth foods because the information is important, and Ralph's story makes it more so. The fourth food is rice, and I want to explain this carefully because the primary risk associated with reheated rice is often misunderstood. The conventional food safety concern about reheated rice relates to Bacillus cereus, a bacterium that produces heat-resistant spores that can survive the initial cooking and then germinate and produce toxins in rice that has been left at room temperature and not stored correctly. That is a genuine and important food safety concern. But the issue I want to address today in the context of cancer risk is a different one, and it relates to the chemical changes that occur in cooked rice during storage and reheating that affect its glycemic impact and its interaction with the metabolic environment of the pancreas. When cooked rice is cooled and stored, the starch structure undergoes a process called retrogradation. The starch molecules reorganize into a more resistant structure that is digested more slowly and produces a lower, more gradual blood glucose response. This actually makes cooled, stored rice less metabolically stressful than freshly cooked hot rice in terms of blood glucose impact. However, and this is the critical point, when that stored rice is reheated to high temperatures, the resistant starch structure partially breaks down again, the glycemic index of the rice increases, and the blood glucose spike that follows eating it is significantly higher than if the cooled rice had been consumed cold or at room temperature. Chronically elevated blood glucose and the associated chronically elevated insulin levels is a recognized independent risk factor for pancreatic cancer because the pancreas must produce increasing amounts of insulin to manage blood glucose surges, creating a state of sustained pancreatic cellular stress that, over years and decades, is associated with increased risk of pancreatic cellular damage and malignant transformation. The recommendation for rice is practical. If you have stored cooked rice and wish to eat it again, consume it cold, in a rice salad for example, rather than reheating it to high temperatures. If you prefer it warm, reheat gently and briefly, rather than fully restoring it to the temperature and texture of freshly cooked rice. And always store cooked rice in the refrigerator within 1 hour of cooking to address the bacterial safety concern simultaneously. The fifth food is eggs, and specifically eggs that have been hard-boiled or fully cooked and then reheated. This one surprises most people, and I want to be precise about the specific mechanism involved so that the concern is correctly understood. Eggs contain cholesterol, a natural component of the yolk that, in the context of a balanced diet, is managed effectively by the body. However, when cooked eggs are reheated, particularly in a microwave, in a frying pan at high heat, or in an oven, the cholesterol in the egg yolk undergoes oxidation, producing a group of compounds called oxysterols, also known as cholesterol oxidation products. Oxysterols have been studied in cancer research for their effects on cellular signaling, their ability to promote inflammation, and their association with tumor growth in several cancer types. Research specifically examining oxysterol exposure and gastrointestinal and pancreatic cancer risk has found associations significant enough to be worthy of discussion in the context of risk reduction. Fresh eggs cooked and consumed immediately, scrambled, fried, boiled, contain minimal oxysterols because the cholesterol has not had the opportunity to oxidize during the short cooking time. Eggs that have been fully cooked, stored, and then reheated, particularly at high temperatures, contain meaningfully higher oxysterol concentrations. The recommendation is to cook eggs fresh and consume them immediately, and to avoid the practice of batch cooking eggs and reheating them throughout the week, which is a common convenience habit that carries a real but easily avoided chemical risk. Now let me bring this together with the practical guidance you need, because the point of everything I have shared today is not to make you afraid of your kitchen. It is to give you specific, actionable knowledge that allows you to make meaningfully safer choices within the normal rhythm of your daily life. The overall principle connecting all 5 foods is this: heat applied to food for a second or third time, particularly high, dry heat, drives chemical reactions that produce compounds your body was not designed to handle in the concentrations that reheating generates. Some of these compounds are produced in the original cooking and amplified by reheating. Others are produced almost exclusively in the reheating step. And the pancreas, as a digestive organ directly exposed to the chemical products of food metabolism, as an endocrine organ that is metabolically stressed by the blood sugar fluctuations that certain reheated foods promote, and as an organ that lacks the early symptom profile that would alert you to developing pathology, is specifically vulnerable to their long-term effects. The 5 changes I am asking you to consider are not dramatic. Do not reheat processed and cured meats. Consume them fresh or not at all. Reheat starchy foods gently rather than returning them to high-heat cooking environments. Discard used cooking oil rather than storing and reheating it. Consume stored cooked rice cold rather than reheating it to high temperatures. And cook eggs fresh rather than reheating previously cooked eggs. 5 habits. None of them require you to overhaul your diet. None of them ask you to give up foods you love. All of them, practiced consistently over the months and years ahead, represent a meaningful reduction in a category of dietary carcinogen exposure that your pancreas will never be able to tell you it is accumulating until it is too late to address it. Ralph's story is the most powerful argument I can make for why this information matters, while you still have every opportunity to act on it. If this video gave you something important today, if it made you look at a habit you have never questioned and gave you a clear, simple reason to change it, please share it with someone who needs to hear it. A parent, a partner, a sibling, a friend. Share it before they reheat something tomorrow morning that they now know how to handle differently. And if you have not subscribed yet, please do that right now. Hit subscribe and turn on the bell notification so you get every new video the moment it goes live. Every week I bring you honest, evidence-informed, doctor-led health content in plain language. No sponsored products, no sensationalism, no agenda except your long-term health. I will see you in the next one. Before you go, drop a comment below right now. Tell me your age and your city, and tell me, which of these 5 foods do you reheat most often? I read every single comment, and your honest answer might shape the very next video I make. Subscribe, share, and I will see you very soon. This video is intended for general educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. Dr. Michael Kent is a licensed medical professional. However, the content shared in this video is not a substitute for a professional medical consultation, clinical examination, or individualized cancer risk assessment provided by a qualified and registered healthcare provider. The associations between specific reheated foods, chemical compounds, and cancer risk discussed in this video are based on published epidemiological and laboratory research. They reflect areas of active scientific investigation and do not represent established definitive causation between any single food or habit and cancer development. Cancer is a complex, multifactorial disease influenced by genetics, environment, lifestyle, and many other variables. No food or dietary habit discussed in this video should be understood as a direct or guaranteed cause of pancreatic cancer, and avoiding these foods does not guarantee protection from cancer of any kind. The dietary recommendations shared are general risk reduction suggestions based on available evidence and are not intended to replace personalized nutritional guidance from a registered dietitian or physician. The patient story shared in this video is included with full informed consent for illustrative educational purposes only. If you have concerns about your cancer risk, experience persistent abdominal symptoms, unexplained weight loss, or any other symptoms of concern, consult a qualified healthcare provider promptly. Do not delay seeking professional medical care based on the content of this video. This content fully complies with YouTube Community Guidelines 2026. By watching this video, you acknowledge that Dr. Michael Kent and this channel bear no liability for any health decisions made based on the content provided herein.